Out in North Carolina, state health officials saying today they think they'll be able to make all adults eligible for the vaccine before May 1st. State officials also talked about an increased amount of doses being sent to the Tarheel State, something local health providers say has been a desperate need since the process started. WCNC Charlotte's Chloe Leshner is live at Novant Health's vaccine clinic in East Charlotte. Chloe, did state officials give us a date for moving into Group 5?
They have not given us an exact date yet, Fred, but Health Secretary Mandy Cohen said it is likely, thanks to a boost in supply, that we will move into Group 5 before May 1st. With vaccine supply expected to grow, state officials are hoping to speed up and get closer to the finish line.
Are working with our vaccine providers right now to understand what they are seeing coming through their doors. And as the governor said, looking at options for potentially even accelerating, moving to the next phase of Group 4 and then into Group 5.
Locally, vaccine providers are still limited by the supply. Novant Health about 800,000 doses short of reaching its goal of giving 1 million doses by April 1st.
We have seen an increase in our baseline allocation. Certainly does not keep up with the number of patients that are in the eligible groups now, but it is increasing, so that's promising.
But several counties in the state have already moved into Group 5. Craven, Greene, and Rockingham counties making all adults eligible. But while the demand for vaccines is still growing, that will eventually change.
At some point, we will reach a time where we have more supply than demand, and we'll really need to work hard to get this vaccine out in a lot of different places and to encourage everybody to get this vaccine.
Novant Health already working on outreach and education and believe the focus on smaller community events will help overcome hesitancy.
I think sometimes people say, oh, you only gave 200 doses that time. It's much more impactful than that. Because when you give 200 doses in a well-trusted community organization like a church, that spreads out. People in that community trust the church, they trust the pastor, they get comfortable with the idea of vaccination, and then they tell other people.
And there are some changes to the way that the state is allocating those vaccine doses. They're going to be sending more to the counties that have lower vaccination rates, and Mecklenburg County is on that list. Live in East Charlotte, Chloe Leshner, WCNC Charlotte.